lots of information for our viewers. So, welcome everyone. Thank you for joining us. It is Tuesday. Every Tuesday, we are hosting Emory Brain Talk Live, where we are featuring Emory faculty and staff and partners from literally around the globe. So as a research center, our mission is to ultimately find a cure for memory impairment. And until we can do that, we have over 50 research projects that we are either leading or collaborating with our partners. And the only way we can do that is to do that successfully is to have people like you be a part of research. So every week we begin with exercise. And as we say every week, what's good for your heart is good for your brain. And so I'm going to ask John to come on really quick and tell us what we need. And then I'm going to come back and do housekeeping. You're going to have time to grab whatever you need. And then we're going to get our hearts going and then dive right into our content. John?
Today, I want to make sure you have a sturdy chair and a good mind and ready to work today. If you need a water bottle, towels, go get them right now.
Okay, all right, you heard that? And so why do we need to do exercise? Well, we need to get moving. We've been at home for well over a year. If you've had to isolate, we encourage you to, again, wash your hands, wear your mask and keep your distance, and get vaccinated. The vaccination centers are opening up all over, and so make your appointment. We strongly encourage you to get a vaccine. All right, so after we have our exercise demonstration, you're going to hear from Dr. Monica Parker. She's going to be talking about Alzheimer's risk and research. All right, we are a research center. Even though we talk about everything under the sun related to older adults, we will definitely today be focusing on Alzheimer's risk and research. And immediately following Dr. Parker, you're going to hear from Whit Morgan. He's going to be talking about our healthy aging study, and he'll be highlighting a couple of things that are coming down the pipe that you as an individual can participate in, okay? Followed by Whit, we're going to hear from Dr. Ken Hepburn. He is our resident guru when it comes to caregiving. So he's going to spend a few minutes talking about caregiving tips. And if you are currently a caregiver, what can you anticipate right now as things are opening up? How do you plan for us returning to normal, right? All right, and then after Whit, you're going to hear from Cynthia Hailey Dunn. She is with the Atlanta Regional Commission. She's going to be talking about aging resources and services for older adults and individuals with disabilities. And then finally, Carlissa Carson is going to come on from the Emory Veterans Clinic. That clinic is going to be happening this Thursday. I think they have a few more slots, and so she's just going to highlight a couple of things that you will be able to benefit from and how you can join. If you haven't, you can get in on this turnaround. If not, they're hosting many clinics, and so this is one of many opportunities where you will be able to join the Emory Veterans Clinic. Okay, it is 2:03. I think I've done as much housekeeping as I can. Get your chair ready and then come back and be ready to take notes because we're going to cover all this information in 1 hour. John, take it away.
First of all, I want to welcome everyone to the Emory Alzheimer's Disease Research Center, and let's get started. With your chair, we're going to be working that core, those hips, those quads, that total body, all right? And I need you to hold on because I don't want to make sure that you don't lose your balance or worry about keeping your balance so we can get strong. Because I'm going to use my chair so I can concentrate on the muscles that I want to use. Let's go. Foot in front, up, boom, boom. Good core, chest up, boom, 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 boom. Rest. Good other leg, in front and left. One. We're working those lower abs, those hip flexors. We're stretching those glutes. Let's go. Boom, boom, boom. Rest. Good. Hamstrings. Tilt at an angle and bust kick. Ready? And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch of the leg. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Feet straight, one at an angle. And we're gonna open up at an angle. Ready? And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Turn. Other hand in the middle. Ready? And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We're going to get them hip flexors, legs straight and locked. I'm going to go at an angle. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Other way. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. Stretch back, and I want you to try. Boom, 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 and rest. Toes out. Give me a light squat. Y'all ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. All right. We're getting ready for our cardio. If you want to sit down, you can. If you want to stand up, let's go. Wait 1 minute. All right. Here we go. Here we go. Come on. Get that flip up. Come on. Come on. Come on now. Come on. Come on. Come on. Let's turn it. Y'all ready? Let's go. Come on now. Come on. Let's go. We have the dance party. Let's go. Get back up. Come on. Back there. Up. Remember, do what you can. Let's walk. Bring it down. Okay, now. I need them hips. I need them hips. I need them hips. I need them hips. You ready? You ready? Let's go. Let's go. Other way. Go. Okay. We about to hula hoop now. Let's go. Let's go round. Other way. Go. That super bass got gold. Here we go. Let's go. If you sit down, I need them arms. Come on. Come on. Bring it back. Let's walk. Right. Let's go. Come on. Let's walk it out. Okay, I need these biceps. Give me them biceps. Come on. Great job. I want to say to you, I enjoyed you. We got that cardio up. We did some body sculpting. We did that waistline. We did all those legs and the extremities. Great job. I'm John Lewis, and see you later. Bye.
Oh, yes, yes, yes. Thank you, thank you, thank you. Did you learn some new dance moves today? Raise your hand. Give John a round of applause. It is critical for you to be moving, and you just had a full body workout in 8 minutes. Okay? We have to move, we have to get our blood flow going. Physical activity and exercise is what we refer to as neuroprotective. And Dr. Parker is going to come on and tell you more about all of that. Hello, Dr. Parker.
Hi, Cornelia. Hi, everybody. Okay, we're gonna.
Slides while you introduce your topic.
Okay, well, what I'm going to talk about today is research. We're getting back as soon as everybody gets immunized. We're going to be seeing you in person, and we want you to participate in research. What I want to get clear is what we're going to do with research. The Goizueta Alzheimer's Disease Research does research in healthy aging. We're looking at Alzheimer's, and why we're looking at Alzheimer's, or the way we're looking at Alzheimer's, is we're looking at ways to, first of all, prevent Alzheimer's. That's one of the pieces of research that we're doing. And we're also involved in clinical drug trials or treatment trials to test out different medications and other strategies for people who actually have the disease of Alzheimer's, to figure out what we need to do to make them healthier. What medication interventions can actually reverse the process of Alzheimer's. So to begin with, what is clinical research? So clinical research is patient-oriented research, research done with patients. It can have different types. There are epidemiologic and behavioral studies, which have nothing to do with body fluids or anything else. It's like they look at where diseases are. So let's take it as an example of COVID. The COVID infections, you see statistics on the news every night. That's the epidemiology, or where the disease is, how it's spreading, who it's affected by. Behavioral studies are how we live, what are we doing, how do we learn? And outcomes and health services research. So there are different types of research that are, quote, clinical, which mean they have to do with actual patients. Next page, please. The epidemiologic and behavioral studies. These types of studies examine the distribution of a disease, like who gets the disease, what kinds of things affect your health, like living in an area that has lots of pollution, as we learned last week, is one of the risk factors for dementing disorders. And other kinds of things in terms of behavioral studies are how people make health-related decisions. How do I manage things for my parent who is losing his or her memory? How do we make decisions about their care? Next. Then we have clinical trial phases, preclinical disease, phase 1, phase 2, phase 3, FDA reviews, and phase 4. So you've heard a lot about clinical trials during the COVID pandemic. Well, clinical trials with medications are treatments that are pharmaceutical kinds of things, and this is how we test for them. So you look at how these things work. I hope you can see it. It's a little vague, but in a phase 1 clinical trial, they only use 20 to 80 patients to test a particular drug in human beings. In phase 2, they checked for efficacy and tolerability. So if they did pretty well with these 20 to 80 patients, they're going to move to phase 2 and expand it to 100 or 300 patients or participants. Phase 3, 1,000 to 3,000 patients or participants. And if the drug does well, then we can submit that drug to FDA approval. That's what's gone into the manufacture and development of COVID vaccines. When the Food and Drug Administration reviews the drug, they either approve it for, in the case of a lot of the vaccines here for COVID, emergency use. That's before we actually complete a phase 4 clinical trial, but we basically approved the drug for safety and looked at it for side effects in people. And more importantly, we're using a drug that we know is going to be effective to target whatever it is we're targeting, okay? So if you're going to be in a research study, what kinds of questions do you need to ask? Now, there are 13 different questions that are there, and I'm going to look at the first one because this is the one that you should be asking. Why am I in this study? Why are you doing this study? What do you hope to prove about this study? If it's not a drug treatment trial, you don't have to ask about placebos or treatment or things like that. But what kind of study is it? Is it a clinical trial where you're testing a drug? Is it a behavioral study where you're trying to understand somebody's behavior? What is it? But looking through that list, and I'm not going to read them to you, but it's like, what is the main purpose of the study? Who does it? How many visits do I have to make to you? Are you going to pay me for doing this study? What are the most likely bad things that could happen to me as a result of participating in this study? So you can see all of those things. But most importantly, if you're in a clinical trial, which is a drug study, it's done under the supervision of a doctor. Your medical doctor will not have anything to do with that study, but your doctor should know that you are participating in that study. Next, please. So just to review for those of us who are new to the Alzheimer's sphere, here at the Goizueta Alzheimer's Disease Research Center, we are doing studies to learn about Alzheimer's disease and other related dementias. We know that the most commonly diagnosed dementia is Alzheimer's, followed by those on that pie. Now, here at Emory, we do research in Lewy body dementia. We do research in vascular dementia, which usually involves the cardiology department. We also do research in Parkinson's disease dementia and also sleep studies. Now, that's not a dementia, but as we've learned before, sleep does figure into the development of dementia. Keep going. We have symptoms that go along with dementia and Alzheimer's. So we know that the older you are, the more likely you are to develop signs and symptoms of dementia. Alzheimer's is predicated on your genetic profile. Women are more likely to get Alzheimer's versus men. And there are other things that go into developing and contribute, to the risk of developing Alzheimer's. One of those is head trauma. Another is vascular disease. And under that, we need to put things like heart disease, high blood pressure, diabetes, heart failure. Keep going. And one of the things, and this is one of the biggest things that has to do with Alzheimer's research, instead of focusing on just a treatment, we know that there are certain things that go along and contribute to the development of Alzheimer's and related dementias. We know that there's a 20-year history of high blood pressure that comes before somebody is actually diagnosed with a diagnosis of Alzheimer's or other dementia. So we're starting to do studies that focus on lifestyle and exercise. Next, please. So for items 1 through 4, those things can be mostly out of our control. We don't have any control over those things, but we do have control over what we do with our bodies, how we live our lives. And these are risk factors for developing dementia that are in our control, that we can control. That's where we have John exercising, because we know that exercise is one of those things that we can do that helps our brain. Next, please. So what are the symptoms of dementia? Everybody talks about memory loss, but there are other things that go along with dementia. Repeating words, phrases, and stories, loss of bowel and bladder habits. It's like, what does that have to do with anything? It's a neurologic function. Alzheimer's and related dementias are neurologic deteriorations, okay? So as somebody's neurologic system is deteriorating, they lose the ability to control their bowel or their bladder, their ability to dress themselves, groom themselves, take care of their bills, pay their meals. They lose the ability to walk safely. Their gait's unstable, so they may be more likely to fall. They may develop personality changes. They may develop psychotic features. And some of the behaviors, which is the next slide, are some of the reasons that people seek care. Next slide, please. So what are some of these behaviors? As a primary care clinician, the most common behavior that brought people to the doctor weren't in personality changes or anything else. It was wandering, getting up in the middle of the night, walking out of the house, doing things that are abnormal and unusual. Another thing that brings people to the doctor are people who have driving difficulties, people who are having increasingly more accidents, getting lost in familiar places. Those are things that generally bring people to the doctor. Not a lot of things that you might think of, but these are the main things. So when somebody has abnormal behaviors or some of the symptoms that I've just talked about, what do you do about it? Do you participate in a research study? No, you go to a doctor. Next slide, please. You go to a doctor because a medical examination is required. We need to review your medications. We need to look at your whole health history to make sure that there's not something that's medical that's causing some of the symptoms that you're observing. Research is not a place to do this. This is why you go and see your doctor. Once your doctor clears you of any medical issues, then you may be able to participate in healthy aging research. And depending upon what your diagnoses are, maybe you are a candidate for a clinical drug trial for Alzheimer's. But again, that's not something a coordinator who's not familiar with your medical history can make. That's something that you discuss with your doctor. Okay, next, please. At this time, I'm going to end, but I do want you to know that if you have clinical symptoms of the nature that we've just recently discussed, you don't need to participate in research for that. You participate with your doctor. You talk to your doctor about your symptoms so your doctor can eliminate and treat any medical things that may be related to that. And if all those things have been ruled out and controlled as normal, then we can refer you to a neurologist and you get more definitive evaluations. Okay.
Dr. Parker, one question came up. Can grief lead to Alzheimer's?
Can what? Excuse me, say that again, please.
Grief.
Grief, G-R-I-E-F. Okay, so grief can be a manifestation of depression, and untreated depression can look like somebody's got dementia. So during the annual wellness visit, when people are starting not to feel well, one of the things that we do is an assessment for depression. Now, why would we do that? How would grief contribute to the onset of dementia? Well, there are some depressive symptoms that look like dementia, but the difference between depression and dementia is we have a treatment, a medical treatment for depression. And a lot of people who are suffering from grief and significant anxiety disorders can be controlled with medications. And these medications and therapies can generally return that person's cognitive status back to normal. But there are people who do suffer from mental illness, chronic mental illness like schizophrenia, who do develop Alzheimer's disease, and they're not necessarily reversible. But in answer to the question, simply, grief can be a manifestation of depression, and depression is something that is treatable. Untreated depression can look like dementia, but you have to do all kinds of studies and tests to make sure that that is actually what's happening. Okay, you also have various kinds of psychoses. How do you differentiate? Okay, that's a doctor, usually a medical doctor in concert with a psychiatrist in consultation, can generally help you understand a psychosis. So when I'm thinking about a psychotic disorder, it's somebody who's compulsively washing their hands. They've never really done that before. They're washing their hands all the time. Or in the case of some of my patients, they were spending money. They were buying things that they didn't really need that led to hoarding. These are compulsive kinds of behaviors that are kind of a psychotic disorder, a manifestation of sane. And again, those are things that you discuss with a trained medical professional, your primary care doctor, who may refer you to a psychiatrist to further evaluate psychotic behaviors. Okay.
Well, we are going to transition and stay within our research vein. Whit, can you come on and talk about healthy aging? And then Dr. Hepburn is going to come on and share with us, followed by Ms. Hailey Dunn, and then Ms. Carson.
Hello, thank you, Cornelia. Thank you, Dr. Parker. And of course, a big shout out to John Lewis for some really great exercise stuff earlier. For those that are attending for the first time here, my name is Whit. I'm the communication specialist for the Emory Healthy Aging Study. I also do work with some other groups here in cognitive neurology. And today I just wanted to kind of give you a quick overview, a little bit about something here that we don't talk about quite as often with the aging study, and that is our sub-study, the Healthy Brain Study. And I just want to give you kind of a high-level overview because we have some really special webinars that I want to talk to you about and invite you to join with us as well. But before getting into that, a quick overview of what is the Emory Healthy Brain Study. And for those that have joined us before, I have talked about the Healthy Aging Study, that online research opportunity where we ask our participants to complete that health history questionnaire. Well, one of the things that we do with that information when we get that health history questionnaire is we look for potential candidates for our Alzheimer's focused sub-study. And that sub-study is the Healthy Brain Study. And what we're doing here is we are working with our study participants longitudinally, meaning you come back in once every 2 years. We are trying to find the biomarkers in our bodies that are going to allow us to ultimately predict and cure Alzheimer's disease. And that's kind of a big task. So we need good participants here, but it does start with that Emory Healthy Aging Study. But one of the things that I wanted to share with you today is a really cool webinar series that we're actually going to be putting on. It's going to be a 3-part webinar series starting next Tuesday. I will drop the registration link here into the chat box for you. But what we're trying to do is give individuals the opportunity, maybe if they haven't participated in research before, they want to learn a little bit more about our Alzheimer's focused sub-study, to hear directly from some of our researchers. We have some participants that are actually going to come on and share their experiences with everybody. We're also going to give you the opportunity to ask questions, similar to the format that we do here in the BrainTalk Live, where we're able to really communicate with these professionals. We want to make sure that opportunity is open to people that might want to learn more about this sub-study and actually work and ask your questions directly with our researchers involved. It's going to last for about an hour, and it's actually going to be a 3-part series. So once I drop the link in the chat here, I'm also going to give you my email address. If you want to register for our next webinar, like I said, it will be next Tuesday at noon. Definitely, we would love to have you join. And also, if you want to send me an email or give me your email address, I will be happy to put you on our mailing list for the invite that goes out for the rest of the webinars in the series. Let's see if I can stop that one here.
And Whit, will you share who will be on the webinar this Tuesday at noon? Well, this coming Tuesday.
Yep. So this upcoming Tuesday for the first webinar in our 3-part series, we're going to have Dr. Law will be presenting. He's going to kind of give you an introduction to the Emory Healthy Brain Study. He's also going to talk about some of the importances, though, with diversity in research, which is a really big thing here.
Excellent. Okay, so Whit just dropped the link. It will be a separate link. It's different from our BrainTalk Live link. And they are on the same day. But if you are interested in knowing more about the Healthy Brain Study and the Healthy Aging Study, there's going to be a whole hour dedicated to it. You know, every week we've been sharing 3 to 5 to 7 minutes to give you a little bit of a teaser about it. But there you can learn all the ins and outs about this study. And it's an unprecedented study. One of the only ones in the country. And they've been going strong for 5 years, but they are still recruiting actively. And so we really want to continue to promote this study and encourage your involvement. Okay. All right. Well, moving right along, Dr. Hepburn, welcome. Great to see you today.
Good to be here. Thanks, Cornelia. And you want me to talk about what happens now that some of us are vaccinated, right?
Absolutely. What is going to be happening when everything is opening up here? Are we just going to go crazy?
Yeah, we should all go crazy and Mardi Gras every day. So I think the one piece of datum that we should share as a way of opening this little talk is that as of today, 88% of adults in America have not been vaccinated. 88% have not been vaccinated. So 12% of us have been vaccinated. So I think that needs to be a sort of sobering background for this talk, because it's going to be a long time before there are sufficient numbers of adults, sufficient percentage of adults for us to feel as though something like normality might be returning. The president is saying that by July, there will be enough vaccine for everybody, all adults to be vaccinated, it still remains to see how many people will be vaccinated. And if it's not an adequate number, I think we've gotten enough information from the scientists to suggest that the sought after herd immunity might not develop. And in particular, the resistance, well, actually the development of variant strains will not be tamped down by having enough people be vaccinated. So I'm going to give this little talk about what we might want to think about doing and what we can do. I think Cornelia will be sharing a link to an article in today's New York Times about some advice that the CDC has issued on exactly this topic. So just very briefly then, what we know about vaccination and COVID-19 is that the existing vaccines offer a very high degree of protection. 95% is an awfully high level of sensitivity, specificity. There's a little wiggle room, the 5%, but they're really quite good. We don't know quite as much about how efficacious they are with variant strains, although we hear scientists expressing some level of confidence. And the other thing is that we're really a lot less clear about, and I think this is really important for those of us who have been vaccinated. We don't know that the vaccination protects us from being able to spread the virus to others. You may sort of remember that one of the main means of transmission is through aerosolization. That is, there's just droplets in the air and they drop on you, or you breathe them into your nose, or you touch a surface that's recently landed on, and now you're carrying them. We don't know exactly how long they live, but for some period of time, if you were to caress somebody on the face, for example, back to my, should we all be hugging everybody? It's possible that there would be transmission. So what we mostly know about vaccination is that we're neither fully invincible, nor are we fully safe among others. And so there needs to be a continuation of a kind of a mindfulness and sensitivity to being cautious. So some general rules of thumb: being licensed, there's no license to engage in risky behaviors. If you're vaccinated, you, I think, remain in some ways even more obligated to act in a way that protects others. You may feel, I may feel, I'm vaccinated, so I might feel I'm in the clear and I don't have to worry. That's just not right. I don't think that's the right stance for me to take. I think I need to say, I have to wear my mask. I have to be very cautious in washing my hands so that I can protect others. And I think the other rule of thumb is to continue to pay attention to what the developing science is telling us about it, particularly with regard to efficacy and variants and the need for booster shots. So the general rule, I think, is don't lower your guard. But in practice, there are some things I think it's clear we are able to do now. The pods that we've developed, I think, can expand. CDC today's article says small gatherings of those who've been vaccinated indoors are fine. So you can have dinners with people who have been vaccinated. You can go visit people who've been vaccinated. So there's that really important, especially for those of all of us who are feeling the sense of just being isolated. Now there's a little bit of a crack in that, and we can visit, we can be with others in what I think I would have called normal ways. I'd already said that protective behavior should be maintained: masks, hand washing, and social distancing. If you're going out to a store, the same rules of staying 6 feet apart still obtain and should. In general, I think the outdoor gatherings are going to be safer, and in those I certainly can include people who have not been vaccinated. again, observing protective behaviors. Be very mindful, be very cautious about re-entering social activities like theater, restaurants, religious gatherings, things that are terribly important to all of us. These are going to open up. And if you want to really open things up, just go to Texas and everything's open. But proceed with tremendous caution in doing these things. Again, you're not invincible, and you're not sure that you won't be infecting somebody. Visit unvaccinated family or friends with great caution. So one of the things the article said was, should grandparents visit, is it okay for grandparents to visit grandchildren? And the article says, yes, with caution. And so I can tell you that I have a trip planned to see my grandkids. And they haven't been vaccinated, but I feel I will be very cautious around them, but I'm also just aching to see them. So, and what does it mean if you're a caregiver? If you're caring for someone with a chronic illness or with a dementia, first I'd say be sure that both of you are vaccinated. There's probably no reason why you and the person for whom you're providing care are not eligible. So if you're eligible, get vaccinated. There's a likely greater availability of vaccinated formal and informal helpers. So that means people who come into your home, if they are vaccinated, you can feel much greater confidence about allowing them into your home. And so too with other family and friends who may help out with the caregiving. If they're vaccinated, that's an expansion of the pod that's reasonable. It may be a while before adult daycare or senior centers reopen. And when they do, I think they're going to be very cautiously done. If the person, if there's a family member who is in an institution or in a hospital, long-term care, assisted living, it is possible that those rules will also relax in terms of enabling your visits. But I imagine that they're also going to be maintaining the wear the mask, wash the hands, maintain distance. So again, don't lower your guard. And what about travel? The advice is proceed with caution. Look for an airline that has booking rules that maybe enable flights to be less crowded. The rules are evolving about whether you need to be tested before getting on an airplane. What's going to happen at the other end? Are you going to be required to do some sort of quarantining? So you got to do the research before you do the travel. But safety in general is going to depend on, how many of those 88% of adults who haven't been vaccinated get vaccinated. The more, then the safer. It's also going to be important to, again, track the evolving knowledge about vaccine coverage. And, be sensible and conservative. You want to plan for where you're going. I wouldn't travel to a place where there's high levels of prevalence of the illness, low levels of vaccination, policies in place that are not terribly protective. So I wouldn't go to Brazil if you gave me $1 million. When you do travel, you're going to have to think in terms of the limits that to exposure to and by others, and to the activities in which you engage. So yeah, I think one of the things that I find myself doing is fantasizing about the next trip, but I also see myself sort of pushing that trip back, not this summer, not early fall, maybe later in the fall, or probably this time next year. So I think engaging in travel planning is a great, if nothing else, a great indoor sport. But putting a pin in the calendar when you're going to do it, I think you take a look at the advice out there. And large gatherings, I would be very wary about. I'm not sure I want to test my immunity. I want to make sure about how I might impact someone else is getting it. And I could, because I could still be a spreader. So the same thing, if there's a wedding, if there's a funeral, if there's a religious service, just exercise lots and lots of cautious thought before proceeding. And that's what I got.
Thanks, Ken. Do you think we'll ever go back to normal? That's one of
I think we'll
the questions
redefine
from our
normal.
viewers.
I think, well, what I think the scientists are saying is that if we get sufficient immunity and if the vaccines can stop the variants and COVID becomes somewhat normalized, it may become the next version of the common cold or the next version of the flu. And I think if that were to happen, and that probably is a couple of years off, I think we will get back to some kind of normal.
Wonderful. And then Ms. Dina said that in Texas, unpaid caregivers cannot be vaccinated yet. Unfortunately.
Well, that's good. That's good. They can, instead of coming into the home, they can go to all those open restaurants. And yeah, sorry, I don't want to let my cynicism creep in, but it does seem as though wise policy decisions could help with this problem.
And I don't know, does Dr. Parker, do you know how soon can you be tested after vaccination? It's a good question. All right, well, we have a few more speakers. And again, we try to cover a ton of information in this short amount of time. So Mrs. Cynthia Hailey Dunn is going to come on and share some community resources and services with us. Thank you for being here.
Happy to be here. Hi, I'm with the Atlanta Regional Commission, which serves as the area agency on aging for the Metro Atlanta 10-county region. I work specifically as a volunteer coordinator with a program called AmeriCorps Seniors RSVP. RSVP volunteers go out into the community as peer educators and provide presentations on topics related to things such as aging resources, health and wellness, and consumer safety. But today I'm here to talk about our Aging and Disability Resource Connection and the types of services that we can help connect people with so that older adults can live safely, live well, and live longer in the community. Next slide, please. I want to tell you a little bit about the Area Agency on Aging, the Atlanta Regional Commission, or ARC. We're part of the nation's aging network. At the federal level, that's represented by the HHS Administration for Community Living. At the state level, it's represented by the Department of Human Services, Division of Aging Services, and we're at the regional level, representing the 10-county region that makes up Metro Atlanta. We work closely with county-based agencies and with direct service providers to make sure that people get the services that they need when they need it. Next, please. Now, there are a number of ways to get in touch with the with aging resources in the country. First of all, at the national level, there's the Elder Care Locator. For example, if you know someone in Ohio or Virginia who needs to be in touch with an area agency on aging for services, you can just go to eldercareacl.gov and you can find the AAA or Area Agency on Aging that serves that community. Here in Georgia, we have the Aging and Disability Resource Connection, and that is operated jointly by Georgia's 12 area agencies of aging, one of which is the Atlanta Regional Commission. And then what we really are going to talk about today is EmpowerLine. That is the ADRC, or Aging and Disability Resource Connection, for the Metro Atlanta community. And it is accessible by calling 404-463-3333 or by visiting empowerline.org. Next, please. The EmpowerLine has a massive number of services available in its database, over 25,000 as of count today. And we also cover 90,000 or more requests per year. So we're out there answering questions as fast as we can. There are 3 ways to connect. One is traditionally with phone-based help. We have certified information and referral counselors who can go through that database. They're very knowledgeable about programs and about eligibility standards and can help people find exactly what they need. We also have a live chat service that's available during weekdays through our website, empowerline.org, and we have a self-service database, and this has been newly unveiled. It's perfect for people who are do-it-yourselfers, who want to look for home health agencies at 2 a.m. on a Saturday morning. Next, please. Now, why would someone call the Empower line? You could have a current crisis and you need help right now, right away. You might be a stressed caregiver who's calling for help. You may need, for example, respite help if you just need a little bit of a break from the demands of caregiving. Or you could be looking for very specific resources where you call up the Empower line and say, I need a mobile veterinarian for my dog, but I can't get out. Can you tell me what's available? Or maybe you need help, but you're not quite sure what it is or how you're going to pay for it or manage it. We can help you find programs that are right for you, and we can see what you're eligible for in terms of programs and financial assistance that can help with that. Next, please. Now, I'm not going to read this entire slide to you. There's a lot here, but these are examples of the home and community-based services that we can help connect people with through EmpowerLine. Under the in-home column, our most popular service would be home delivered meals, or what's commonly referred to as Meals on Wheels. But we can also help with, for example, if you have a loved one who's in a nursing home or assisted living facility and they are having quality of life concerns, the long-term care ombudsman can actually help resolve those issues. On the community-based side, transportation is always a much-needed resource. And another example of that would be adult day programs. For many working caregivers, adult day programs are a vital lifeline to helping them stay in the workforce and get the care that they need for loved ones. Next, please. And in addition, we have a number of other resources that we can connect you with. I'm going to go slightly out of order here, starting with Georgia Cares, which is the state health insurance assistance program for Georgia. There is a version of Georgia Cares in every state in the country. If someone has questions about Medicare, for example, how to choose the best plan for their particular needs, or if they are having trouble affording monthly Medicare premiums, or they want to find prescription assistance for drugs that are too expensive for their budget, Georgia Cares counselors can help with that. And through EmpowerLine, we can connect you with Georgia Cares assistance. Then there's also Benefits Checkup, which is a national program run by the National Council on Aging. You just put your information into the system, and Benefits Checkup will actually give you a report that's customized for you and shows exactly what kinds of resources and public programs you may be eligible for. Senior SAP is another good program that we can help connect people with. That is the Supplemental Nutrition Assistance Program. Senior SNAP is a little bit more customized for the needs of older adults, and the system makes it much easier for an older adult to apply for benefits and to get those each month. For transportation, we can provide help with a variety of things, whether it's finding out how to use MARTA mobility, how to get MARTA discounts, or how to find a volunteer driver program that will take you from your doctor's appointment to your home and back. And in terms of energy and utility assistance, there are quite a number of programs out there. There's the LIHEAT program for heating assistance, and the Georgia Public Service Commission has utility assistance programs that cover everything from phone hookups to internet service, heating, and electricity help. That's just a very small sampling of the kinds of services that we can make available to you through EmpowerLine. Next, please. So the bottom line is, if you have questions, we've got answers. Our website address again is empowerline.org, and our phone number is 404-463-3333. And if you would like to have an RSVP volunteer give a presentation in your community, which we do on Zoom currently, please just contact Empowerline, and we would be glad to set that up for you. Thank you so much for your time.
Wow, thank you. The questions are rolling in.
Okay.
Is there a limit or age to qualify for these services or income?
It depends on the program. Some programs have no income requirements whatsoever. Most programs that are funded through the Older Americans Act are for people who are 60 and older. We do have some programs, however, for which you qualify at age 55. For example, our Senior Community Service Employment Program, which is available through the state network, that is available to people starting at age 55. So it depends on the program. The best thing to do is just to call.
And you mentioned respite care. Do you know the ins and outs of that specific respite care program?
There are a number of different forms of respite care, one of which may be having someone come in to provide assistance, a home health aide or home care aide to come in. There are also examples of out-of-home respite care where someone might stay in a nursing home for a short period of time while a caregiver, for example, has surgery or attends to other needs. Out-of-home respite may be less accessible right now, of course, because of COVID.
Absolutely. And again, one viewer just said, wow, thank you so much. I wish I had known about these resources when my mother was living. Again, we just want to be a resource for you. To know and to be informed is half the battle. And now you know how to share this information with others. Ms. Hailey Dunn, thank you so much for being here. We will be inviting you back in the coming months as we continue in this virtual environment. So moving right along, it's 2:52. I am very mindful of the time. We are going to have Ms. Carson share a quick update with us about the law clinic that is coming up. And then we're going to hear from Matt Doiron from our Cognitive Empowerment Program.
All right. Thank you so much. I'm actually very pleased to announce that our clinic is at max capacity. And this is the clinic that we're going to host on Thursday from 2 p.m. to 5 p.m. via Zoom. We will take some extra veterans in case there's anyone out there that really wants to attend this clinic, because every now and then we do have no-shows. So we're happy to sign up maybe 2, 3, 4 others. And if you do want to sign up for the clinic, please give us a call today at 404-727-1044, or you may also contact us by email at roxana.poosh@emory.edu. And I'm actually dropping this info down below. So I'm going to include our email address and our phone number. And again, this is for anyone that has decided last minute that they want to attend Thursday's clinic. We're going to be helping out with discharge upgrades, VA disability benefits issues, and also basic estate planning like wills, powers of attorney, and advanced directives for healthcare. And if you have to miss this clinic, we do have clinics coming up in the future. Just give us a call and we can give you the dates for those.
Awesome. All right. You all are at capacity. That is wonderful to hear.
Yeah, absolutely.
Great. Okay. Well, Matt, come on in. What is happening with CEP at 3 o'clock today?
Everyone, so CEP Community Live is going to be starting in a few minutes. Today we are joined by Suzette Binford. She is our amazing social worker, and yeah, so just please come by. We're going to be talking about a few different topics about discussing your diagnosis with others, and yeah, so hope to see you guys there.
Okay, so if you want to continue with your virtual learning, again, remember learning in these types of environments and keeping your brain engaged is what we refer to as neuroprotective. So Matt's going to drop the link. If you haven't joined Cognitive Empowerment in the last couple of months, since January, we have been having their program follow our BrainTalk Live every Tuesday. They begin at 3 p.m., which is why we really try to get through all of this content in 60 minutes, okay? All right,
And
so
really
ahead.
quick is like, I just remembered the other thing that we're going to be talking about today. We're going to be talking about other community resources that you can utilize. So I think that I just wanted to bring that up because I think that there might be a lot of people here in Brain Talk Live that might be interested in that. So yeah, if you're looking for some other community resources, please come by.
Excellent. Okay, so Dr. Hepburn is still on. He may not know the answer to this question, but Ms. Helen is asking, what about people who are homebound? And I don't even know, perhaps you can contact the Empower line. Maybe they may be a reference point on how to get our homebound and older adults vaccinated. Any insight, Ken?
No, I can't think of anything. Maybe I try if Monica's on. It's a great question. I don't know the answer to it. I would try a home health agency and see, and that's probably where I would start with something like that, or call a primary physician, primary care clinician, and see if that person has any hint. I don't know of any home delivery.
Local health department
Local health department, that's a good idea.
would be my first guess.
Yeah,
You can look into that. I mean, that's
that's an
something
important question. We should know the answer to that.
we don't know it all, but we do try our best. All right, well, it is 2:57. Thank you. There's a lot of Zooming going on this week and this upcoming week. So take the time to grab all the chats, all the links in the chat. What's the name of the workshop for veterans? I think, Crystal, did you just drop that link from Mrs. Carson? The name, I think they just want to know the name. You're muted.
Yes, sorry. What's the name of the workshop? Well, we just call it this one is called the ADRC/Emory VCV Clinic. And like I said, we're going to be doing the discharge upgrades, the basic estate planning, and also VA disability benefits. We're going to take those questions as well. And the clinic official name is the Emory Law Volunteer Clinic for Military Veterans.
All right.
And I can type that again.
Yes. Again, we want you to be well. We want you to be healthy. And, you know, a lot of what we're doing is, you know, the impetus is research participation, but you can't participate in research if you have all these other things going on. So we want to, you know, add value to you while you are aging in place at home. Pretty soon, things will be opening up in our research center. We want you active and participating and feeling good about coming in and being a part of memory, engagement, and research. So thank you all for being here. Thank you to our new viewers. We will see you back here next Tuesday for BrainTalk Live at 2 p.m. Eastern Time. See you later.